Hello everyone. In today's Explain Why series, we are going to understand the concept why the alveoli do not rupture even during maximal inspiration. Suppose if you have a balloon and you keep on blowing through it with maximal pressure, it is going to blast out. But the same thing does not and should not happen in an alveoli. Even with deep inspiration, the alveoli will expand, but it will not rupture under normal conditions. So how is this rupture prevented? Let's try to understand the reason behind it. So there are several reasons for the alveoli that is not getting ruptured during an inspiration. First, what happens is whenever the alveoli is getting expanded, what will happen is this expansion is called as the compliance, and the way where it comes back to its original shape is called as the elastic recoil of the alveoli. So whenever we are trying to expand it, what will happen to the elastic recoil force? The elastic recoil force will try to compress it. So as and when the alveoli is expanding, so if you try to increase the alveolar size, the elastic forces, they will try to push the alveoli inside, causing a greater inner pressure, which prevents the rupture. This is one condition. So as and when the alveoli is expanded, what happens? Let's compare two alveoli. Suppose a smaller alveoli is like this and it is getting bigger like this. So what happens is, let's see if there is a surfactant layer like which is this coating in this alveoli. Now what will happen is this surfactant will be spreaded across a greater surface area, because now the area is big but the amount of surfactant is same. So what will happen is they will be spread smaller areas across the entire region. Now all of us know that surfactant helps to reduce the surface tension. Now they are spread across a larger region. So what will happen is the concentration of the surfactant is naturally getting decreased. The overall amount is same, but this, due to the excessive spread in different areas, the concentration of that particular area is going to come down, and surfactant will prevent the collapse of the alveoli or the surface tension. Now since it is spread over a wider area, what is going to happen? The surface tension is going to increase, and that increase is going to try to recoil the alveoli back to its original shape, preventing the rupture of the alveoli. So this is two things. And next thing is there is a surrounding parenchyma. We are just thinking about the alveoli, but there is a surrounding parenchyma which is surrounding all the alveoli, and this will not give excessive space for it to expand and thus preventing the rupture. And final answer is the alveolar interdependence. This alveolar interdependence means even the other alveoli are also getting increased in size. So what happens is a single alveoli is not getting too much space to expand and not getting ruptured, because the other alveoli are also getting expanded. This interdependence also prevents us to help the collapse also. Let's try to understand how. Suppose a smaller alveoli is trying to collapse. What will happen is the surrounding alveoli will try to pull it and prevent the collapse. In a similar manner, when one alveoli is trying to expand, the surrounding alveoli is also occupying the space and try to reduce the more of inspiratory expansion and preventing the rupture. So the first reason is elastic forces are going to increase whenever it is expanding. The surface tension is going to increase, then the surrounding parenchyma and the alveolar interdependence. So these are the major reasons why the alveoli is not getting ruptured during a maximal inspiration. I hope it's clear. Thank you for watching the video. We'll see you in the next video. Thank you so much.